Welcome, ladies and gentlemen, to the second day of Next Normal. Was an amazing presentation from Team White, and really glad to have him back on conferences after a while. Very meaningful, very insightful. Definitely, based on the comments, we can say it was an amazing presentation. Moving forward to the second session for today, which is video engagements in Next Normal. And really pleased to welcome today Luigi Boaretto from Zambon. Hi, Luigi. Come stai?
Hi. Bene, grazie. Hi to everybody.
Thank you very much. Goren from Teva. Hi, Uri. How are you?
I'm fine. How are you? Hi, everyone.
And Mark Benthin from viihealth. Hi, Mark. Same question for you. Hi, Mark. We can't hear you. Okay. So let's kick off with this interesting discussion. As said, we speak about video engagement, and I don't know for you or for your organization, but video engagement in pharma is definitely just at the dawn, which means when we speak about video engagement, we still don't know how to do it properly. However, I think it's definitely very good timing to speak about this theme and to set up the foundations for that. So I would like to start with the first question, which is that the current state of video engagement in the omnichannel suite. How does it looking like? Maybe we can start with you, Uri, and continuing the speaker flow from Teva, because previously we had Tim.
Yeah. So I think the state of video engagement has been boosted in the last year quite significantly. Like we are doing now, basically all of our offline events have been basically canceled. So we have had to learn to do better video in terms of engagements between people, not in the same place. But that's one part of video, which I think has been boosted a lot also on the field for pharma, for reps, for MSLs, for everyone who is touching a customer, needing to do it through video engagement, because this is basically almost the only channel to do it with seeing the other person. But then there are also video content at large that pharma can produce, and I think we were not in a bad shape in that place. But I think again the idea is how to connect it to the overall thinking and how to kind of mix between the two, making face-to-face, let's say, video interactions and video content being more easily and readily available, connect with each other and complement each other. So I think that's the next stage, but I don't think we are far behind. I think video has been there for a while. I think it needs to be, and it is getting to be more sophisticated in some ways.
Definitely.
So that's my view, my initial view.
Thank you, Uri. Mark, how do you see it as a solution vendor? Mark, we can't hear you.
Sure, definitely. I agree with Uri in terms of video acceptability over the last couple of years. Bandwidths have improved significantly. We're moving towards an environment where 4G will eventually become 5G. So it seems that the pandemic has also helped to democratize the access to video and the acceptance of video. And in fact, to make the demand for more visual content that's easy to understand. I think the next stage from what we see is that it must become more orchestrated. It needs to be not just videos that are nicely recorded or an interview with a key opinion leader or something from a conference. It needs to be part of that overall brand strategy, and to use video and video as a medium to be able to convey engagements and drive better engagements across the board. So I think that's the next phase, where video in effect needs to grow up to become much more of a usable tool for the industry as one of the main media across these omnichannel efforts.
Luigi?
Well, from my point of view, at least for our experience, actually it was the COVID situation that brutally put us in the videos era, and I can recognize two different kinds of videos. Actually, one is the video interactions, where all of our sales force or all of ourselves were just started to do it from one day to the other with all the tools that we had at that moment. And we were trying to understand how to be effective in the video interactions, which I believe we are still far to be in the position to say, yeah, we are now mastering the situation. I mean, even simple things like, well, how to define my background, how to present myself, how all these things are really resonating with my message or not, how to not lose the attention of my stakeholders. All these things I think we are learning. It's not yet there that we are really mastering. And the second chapter, yes, it is the non-live interaction. So, I mean, can be pills of webinars, can be whatever movie or whatever things, because even video is really just videos on person speaking, or we are moving into an era where, I don't know, cartoons, avatars, or whatever will play a role, even in the pharma business. And so, yes, we are using videos. We had and we have to do it. I'm not so sure that we are already the high quality level in this field, actually.
Thank you, Luigi. I mean, I would say that we are in this era or phase of doing pre-approved videos, which are from perspective of compliance, okay. But how do you see the possibility of doing dynamic, flexible videos from the rep, which means you have a possible tool X, and the rep is having the possibility to launch and to record a personalized video note to the HCP or other stakeholder. Would that be a possibility from your perspective, or do we have the compliance in front of us who is not allowing it? Who would like to reply on that?
I can take a shot at that. I don't think we will be able to do that so fast. I think, though, that technology could help us to do pre-approved videos that look much more like something that you made specifically for a person. So I've been privy to some technologies that do the slice and dice of recordings in a way that they look seamless and tell a story based on a script. And I think it's a interesting idea to do it and get the reps, but there is a production effort here and that needs to be assessed, right? Because it will take quite a lot of production to create all those scenes, do all the slicing and dicing and matching and doing. I don't see like live recorded videos where, I mean, at least not formally. Let's say I'm pretty sure that video messages have been sent from reps to doctors as they use WhatsApp or other chat, but I don't think it will be a formal channel or something that we could master, just because the risk is too high. It's not just, you know, it's recorded. It's something that is out there. You need to approve it. You need to see, and not that I'm not counting on our reps, but even sometimes you think you can say stuff and it seems totally reasonable, and someone else looks at it and sees the other way. I mean, it's just not. It's not a matter just of trust. It is a matter of having the process. We could circumvent it, but I wonder, would the effort make it possible in the long term? That's a question we'll need to think about as we move along.
So no TikTok channel, no TikTok rep channel at all.
Yes, but not on his job.
Absolutely. Mark, how do you see that from the perspective of compliance?
Well, as Luigi mentioned, there's many different types of video. There's obviously remote live meetings, so we're all getting used to that, and certainly reps are becoming more comfortable with their digital selves. There's also the pre-recorded video, and we do think that there is that in-between stage perhaps not to the extent of single representatives recording video messages and WhatsApping them to every one of their friend physicians, but in a compliance mode, something that follows the same model as an RTE, as a rep-triggered email. We do think that video messages recorded by representatives at a non-personalized level, meaning not to the individual physician, but as statements about a moment in time of those relationships, can be useful and can be part of an overall discussion. But that's one of the items that we are working through now, to be able to say, well, this is another use case where video is pre-recorded, the rep is part of the conversation, but the compliance is in place, and there is no circumventing or any other aspect, because that is a short-lived process. So multiple different types of video, ease of production is critical, and being able to ensure that it layers into the existing infrastructure that's already in place in this day and age.
Luigi?
Well, my first thought is, again, it's always starting from the customers. Is something that the customers likes or not? They need it or they want it or not? If just think about the typical social media that my age could be using, which is Facebook. When I discuss with my son, they say, well, I'm not in Facebook at all. It's something for old people. Instagram, more or less, and then TikTok maybe, and Clubhouse or whatever is the new trend. So first of all, what our HCP wants to be used, and what is the type of interaction that they would love to have, that would need to have, and still I don't have clear. My second point is, but yes, for sure, they will need some video interaction, and this comes to the point of the compliance. There has been a lot of discussion and consensus on the fact that we need new digital capabilities in the companies and whatever. I've heard very few times just discussing about compliance capabilities or GDPR privacy capabilities, not only for the pharma business, but overall business, because they are the one that we need more very often, actually. And this combination of know-how on pharma compliance, GDPR, but also on technology and needs of customers, is very rare. And for sure, the question is not really if, but how, in which way we can be compliant, but also effective in the video communication. And very often what we miss more in the companies are this kind of know-how, which I believe is scarce in the community everywhere, I would say. But it's my opinion, so I would really love to hear your point of view.
Definitely. Especially, I think we have to add that we always have to ask the customer, right? Because sometimes we want to do something, but at the end of the day, the customer don't want it, and of course, everything falls in the water. Next question.
I would actually say that you have to ask the customer also, but you could also test and learn. Asking the customer can be like direct ask. Do you want to have video interactions? I don't know what I would answer. But if I get a good video in the right context, I would probably enjoy it, right?
Definitely.
So asking the customer could come from test and learn. And doing short tests to see the engagement, because sometimes when you see the product, you say, you know what, that could be interesting if it comes in the right time and in the right place with the right message. If you ask me on a poll or a survey, I might say no, because what do I need another video to watch? No. So just be careful with asking or the method you are asking by.
Yeah. However, we can even reference Steve Jobs, right? And I see that our colleague will ask a very interesting question, which is how do you know if our audience like it or not? It is until you produce and put it in the content so that they see it, right? Sometimes the customer don't know that he needs it, right? And this is a reference coming from Steve Jobs, for instance.
Yeah, but we're not Steve Jobs. It's kind of singular with him. But testing, I would say, could help you, right?
Definitely.
Well, actually, I fully agree. I mean, how to understand if it's something that is really liked or needed by the customers is very important, and testing is very important. But maybe also having different kind of KPIs that at the moment we are not collecting, the different kind of information that are there. I mean, we are far for really trying to fine tune not only if one single video it works, but generally speaking, what is really needed in that moment, in that period, with that customer. That's very challenging, and it applies to videos too.
Definitely. Next question, starting with you, Mark. How can we benefit from video engagement and proper stakeholder channel?
Well, what we've been seeing, and I agree with all the points about stepwise testing and trying. One of the things seeing with video as part of email properly integrated is a much greater degree of engagement, more time spent on key message, more click-throughs, and overall greater time spent by a significant factor. And the reason there is that generally physicians are looking for content that they can consume easily. And so while they might have time at certain times of the day to read full content, if they can consume it in a couple minutes and get the essence and then come back to it later, that is a very convenient packaging. And so that convenience of that packaging has been tested and has actually shown to have a very significant on their engagement. And it makes sense because it's about bringing those messages closer with requiring less effort on the physician's part to get that initial concept. Now, where does it fit as part of an overall omnichannel campaign? Perhaps it's part of that early lead-in. Perhaps it comes in later on after other messages have been sent. It's part of the campaign, but it needs to be measured and deployed in such a way that it can also be done effectively at scale at a reasonable price point as well.
Thank you, Mark. Uri, Luigi, let's start with you, Luigi, this time.
Yeah, well, for sure. I mean, if we are discussing about it, if the business is discussing about it, is because there is a need, and there are also benefits for both the pharma companies and the ACP. Simply, for example, an ACP can really have informations and proper communication even when he's not working, when he's more relaxed, or anytime he wants. On the other side, for the pharma companies, before, when in the face-to-face area, we had to really to convey few messages in 5, 6, 7 minutes per time, and so few brands very focused, few things. Now potentially with videos, you can even expand the product, the range of the product that you are promoting, not only 2, 3 per cycle. You can potentially go everywhere, and you can really access more time, not just queuing out of the office and having the permission to enter. You can try. So for sure, there are a lot of benefits coming out. Is how to really find the possibility and the way to maximize this new opportunity, and that's really the more difficult things. And but again, there are very successful examples. For example, for us, one of the most successful one was to really use very interesting webinars with the very important key opinion leaders and extract some pills of these webinars, and then use these pills distributing and spreading, even increasing the reach potentially, because sometimes it's another benefit of the videos. You can have access to more, potentially to more HCPs. So yeah, just a few examples, but I hope will be useful for the discussion.
Thank you, Luigi. Uri?
Yeah, I think diversifying the content and giving your customer a way that they can choose different types of content and engage with you with different kinds of, let's say, media is something that always enriches the experience, right? If you only send text for text-based messages, long text, people get tired. But if you mix it up, and there's video, and there is infographics, and there is text, and it gives you a way to enforce the messaging in different ways, and I think it's something you should look, especially if you're doing an omni-channel or a multi-channel campaign. You need to find out that you're not just bombarding the same thing across all channels. Then you're just annoying the customer. You need to give an idea of why he got this message this way. So kind of match the content to the medium. So not having video just for talking heads, having video where we're seeing something or presenting something makes sense, or giving up the personal touch. So I remember we used to do in webinars is the KOL kind of has a short invite video that you send before, so the speaker, and then it becomes personal. He's inviting you to his webinar, and physicians see that as very personal, and probably will attend more than just a usual save the date. So you could use that, but it has to be in the right context. I also agree with Luigi that taking up video content that you already accumulated through webinars, through recordings of many things we do anyway, and cutting them and sending them as small pieces and tasters makes a lot of sense, from reuse and getting efficiency, and from making it more interesting to the customer. So for sure it has a place, and I fully agree, and I fully understand why it should shoot up the customer engagement with the channel. But again, don't overdo it. Don't go from a blue ocean to a red ocean, right? So kind of keep it into the mix.
Definitely. I mean, many say in overall that watching is the new reading. I mean, even today, if you want to learn something new, you go to YouTube and you find almost about anything, any kind of theme.
Yeah. I've been struggling with my kids for a while now. They don't read. They just watch videos on all kinds of screens that they have, from the smallest to the biggest. It's all visual consumption. Reading is really not, they're not built for reading somehow. But it does risk the imagination in some ways, because everything is, but we do like seeing movies, always did.
Yeah, very good point, especially about the imagination. The next question. So can pharma benefit from the YouTube effect? I said watching is the new reading, based on these new ways of HCP engagement. Mark?
Well, I think if we take it from the HCP perspective, over the last year, they were probably already receiving many, many emails of essentially the same format. And that just went up about 5, 6, 10 times over the last year. So now they're receiving a ridiculous amount of content. It was useful to be able to bring that message further forward, as we've heard as well, to be able to change the mix a little bit, to stand out from the crowd. It doesn't mean that you'll be opening up your own Netflix channel, but the vehicle itself, the medium, is useful to be able to get that level of engagement. Certain content also needs greater depth of attention. So it's not always just short format videos. Longer formats have their place too. And that's why I said up front, what we're seeing is that video has been played with, and it's there, and the 80% of the internet traffic is video. The next stage of video is the orchestration, though. That will need to get, we'll have to move into that stage very quickly if we want to take advantage of it across our omni-channel efforts.
So we miss the maestro, which we have to. Okay, Luigi, Uri?
Well, first of all, if we are here to discuss not only about today but also in the future, and I mean, if we think about our stakeholders, I mean, we know that the young people will come also one day, HCPs and physicians, whatever. And I mean, I have the same experience with my sons, right? That if video is and any kind of concentration of videos, channels of videos is the way to learn, will be also in the future. And to me, something that is probably an opportunity for the closer time, not to wait 5 to 10 years, is that another thing that I've seen is changed dramatically is the need for our customers to don't receive only brand information, but unbranded information, more wide information on disease, on the situation, and whatever. Under these categories, maybe that channels, even like YouTube, can be really, in a way, used, and even today. I mean, that's something that, again, is a question to have the competencies on compliance and that we were saying before, but yes, there is the need to know more. The world is changing so fast every day that for sure we as a pharma company can help our customers to be more updated, to receive more information, and not necessarily actually on the brand. Actually, it seems that even you are more successful and engaging if you start with a funnel which is broader, discussing about the broader situation, the trends, and then narrow down once you understood the need to your value proposition, what you can really concretely serve to your customers.
Thank you. Uri?
I would like to focus on another aspect of this. I think video production has been quite costly. Usually it costs more, right, than any other content production you do. And I think once we find, and I think we've seen it, right? So today, and going back to TikTok, doing a production on TikTok is something that is managed completely within the mobile phone, also in Instagram with those light rings and stuff like that. So I think finding those skill sets and internalizing them in pharma companies, so video production becomes totally streamlined, less vendor dependent on the production side, and making it something that you can do on a daily basis without giving it too much thought or too much work. Like, you want to do an article, you do an article. You want to do a video. It should be as simple as that, and I think that will boost. I think as long as video production is looked at as a video, as a cinema production, and the cost, it will be hard to make it, very, very into the day-to-day of marketeers. It will be an event. You do a day, and then you cut and slice all the video as to much as what you can. But I think now that video production has become so simple that your iPhone and your Samsung Galaxy can give you basically all you need, that is what will drive it, I think, even more, because we understand the value, but it's hard to do. So we'll need to be better at doing it and producing it, and then I think you'll see it more and in more situations than you've seen it up until now.
So in pharma, what issue do we have? Skill set or the tools? Because you mentioned TikTok, you mentioned Instagram.
So it's not about the channel. I'm talking TikTok because TikTok, in order to make you be able to put a video, also have a suite of editing and helping you get the video to be in the right place, right, and doing the right things. So I think all these kinds of tools and apps that we have, and then just getting people to know how to use them and to know how to produce a good video. And there are courses out there of people teaching you how to do a video with your cell phone. Just getting that into the skill set inside the company will push it forward. I don't think the tools are the issue. I think it's more about the mindset and the skills, and then how to push it forward compliantly into your emails. So that's the second step, but just getting the production done, getting an inventory, I would say.
I suppose there on YouTube you have some videos how to do YouTube videos. So
yeah, for sure.
Luigi, final verdict.
Well, I think you've raised a good point, and I would say that over the last year, because of everything that we've all experienced, now is the time. We've democratized the video. It's certainly become a lot easier to produce. It is ubiquitous everywhere. Now is the time to bring it into the next phase. And we've already done a lot of work to from our perspective to bring that forward. And we're seeing good results from it in the variety of different ways that will find their place, and obviously lever all of the infrastructure that's already in place and keep it so it's straightforward. So our expectations have changed. No longer is every video expected to be a Super Bowl commercial. It's really about getting the material out, getting the message out, and I think video will definitely have a good place in the years to come.
Yeah, from my side, nothing nothing else to add to the need of the videos. Just one probably sharing of an experience about what Uri said about the skills. I mean, we have just hired just graduated a brilliant person in my team, and we had to organize a big event on this new operating model involving everybody. So first things, you need videos, right? And I was amazed because we didn't need any agency. She was making all the videos by herself, and the quality was great. So really, it's a question to know how to do it. It's not a question of tools.
Definitely. Gentlemen, thank you very much. And we are continuing with the agenda. It was a pleasure, and take very good care.
Thank you, Dario, for inviting us.
Dario.
Thank you.
Thank you, Dario.